Good day everyone, I am Pojas from BSN-2A, and at this time I will be performing urinary catheterization for male and female. First, let me define to you what is catheterization. So, it is an introduction to catheter through urethra to the bladder for instilling or removing fluids. So, first thing first, I will check the patient's chart. So, the patient is Michaela White. Her birth of date is February 10, 1980. Her medical record number is 124016. So, I will be checking if she has allergy regarding with iodine or betadine products and latex products. So, I can see that she has no allergies with that. So, the patient is unable to void 7 hours post-op. So the doctor ordered for insertion of Foley catheter. So first, let me wash my hands or sanitize my hands. Okay. Next, I will gather my equipment. So I have here my equipment. So the most important thing here is the catheter. So the lubricant. So I have the catheter here with the size of French 14 to 16, which is appropriate for female, and the size of this catheter is French 14 and 16 again, and the expiration date of this is January 2025. So I have also here the urine bag, the 5 cc distilled water, plaster, and all the things needed in the procedure. So right after, I will introduce myself to my patient, and I will explain to her the procedure. So, hi Mrs. White. By the way, I am Creziel Jane, your nurse working for today. So, how are you? Okay. So, by the way, I am here for insertion of catheter. So, what is your first and last name again? Okay. So, do you have any allergies regarding with betadine, iodine, or latex products? Okay, thank you. So, I will check again your medical record number to make sure that your medical record number is right. Okay, 124016. Okay, thank you. So, may I ask, when was the last time you urinated? So, by the way, the doctor ordered insertion of catheter because you are not, because you was not unable to void 7 hours post-op. So, this process takes a quite long time, but I know you can handle it. So, through tubing, I will insert the tube in your urethral opening to the bladder to sit in there and to drain those urine that is stuck in your bladder. So, that's all. So, do you have any questions? Okay. Yes, Mrs. White, it is quietly painful, but I just want you to breathe deeply and just relax. Okay? So the next thing is to provide privacy for my patient. So now I will close the window, and I've already closed the door. So next is to perform perennial care for your patient. So I will use the gloves for safety purposes. So, Mrs. White, it is a little bit cold, but I know you can manage. So, I will be cleaning your clitoris down to your anus from top to bottom 3 times, okay? So, I will remove your blanket. using this one. I will be using this. So, be ready, Mrs. White. So, I will be cleaning your clitoris 3 times. 1, down to anus. 2, top to bottom. 3. Okay. So, I will dispose now my gloves because it's already contaminated. Next, I will wash my hands. Now, I will position my patient into a dorsal recumbent position with feet apart. So, Mrs. White, I will be positioning you into a dorsal recumbent position. Okay? Okay. Now, I will also attach this eye sheet to provide more privacy for my patient. Okay. Okay. That's good. So now, I will bring my things or the equipments right here. Next, I will get the 2 cotton balls. Prepare it here. 2 cotton balls with betadine. That can be used later for the disinfection. Now I will place this waterproof underpad later. First, I will use these sterile gloves. The right hand again. Okay, I will dispose this one. Now, I will insert this waterproof underpad. Okay. Now, I will attach the catheter into the urine bag and also the 5 cc distilled water. So, I will attach it well so that it will not inflate the balloon. Right after, I will spray using the kidney basin. I will spray the tip of the catheter for about 1 to 2 inches with lubricant here in the kidney basin. Okay. Using my non-dominant hand with my thumb and forehand finger, I will spread the labia like this. And now I will disinfect the meatus with 2 cotton balls with betadine. Okay. Okay, thank you. So, Mrs. White, I will now insert the tip of the catheter in your meatus. So, I want you to breathe deeply and just relax, okay? So, now I will insert the tip of the catheter for about 2 to 3 inches until urine flows. Okay, just relax, Mrs. White. So now I can see the urine flowing. So at this moment, I will pull the 5 cc distilled water until retention balloon snuggle against bladder neck. Okay. Okay. Done. Now I will remove the drape. Now I will position the urine bag over here. There's a hook here. Now using the plaster, so using the plaster, I will put here in the hose at the thigh of the patient. Okay, I will be removing my things. Brown, that's all good. This is white rather. Now I will remove my gloves to prevent contamination. Next, I will wash my hands in order to be safe. And at this time, I will record the summary of the catheterization for my patient. So her urine, so the urine that is drained is 400 ml. The reaction of the patient is normal, and the urine is light yellow. So that's all for female catheterization, and thank you.